Today we're going to have fun. I'm joined by Dr. Sheila Barbino, a globally recognized cosmetic surgeon.
When I do any procedure on a patient, the days leading up to it, I have kind of a mental picture of what they look like now and what I want to make them look like afterwards. And if you don't have that vision to see the before and after before you go in there, you're guessing.
The difference between an average doctor and a great doctor is they give a shit.
Everyone deserves to look beautiful or look like the best version of themselves. You know, a lot of people think you only have one facelift and then you die beautiful. You know, it lasts for the next 30 years, but that's not the case. So I had a bunch of 20, 25-year-olds that came to me that had excessive submental fat, and I dissolved it, and they had these necks that looked like old ladies because they didn't have the nice skin retraction that they talked about with the dissolving of fat. When you dissolve that much fat, you're gonna have skin laxity.
Hello everyone, Paul Fulford here, and welcome back to the Optimize Outcomes podcast. Today we're going to have fun. I'm joined by Dr. Sheila Barbino, a globally recognized cosmetic surgeon and aesthetic specialist practicing in Southern California and Los Angeles, as well as in Austin, Texas. Dr. Barbino is known for her natural confidence-boosting results through cutting-edge treatments. From pioneering new products like exosomes and introducing Latibo, the latest neurotoxin from Korea, Dr. Barbino continues to innovate in the field of aesthetics. Sheila, thank you for joining the podcast today. So again, thank you for joining the podcast today, Dr. Barbino.
Thank you for having me.
Oh, my pleasure. We're going to go all over the place today, right? So
I love it.
You've been traveling a lot internationally, right?
Yeah.
Probably most recently internationally was MCAS, and then
Paris.
Who doesn't want to go to Paris, right? I mean, any time of the year.
Well, it was cold, it was rainy, but it was certainly worth it, and I learned so much. And
I was there a few years back, and it snowed in Paris, which was gorgeous at MCAS.
I bet.
So what do you feel like new internationally is something that's making its way to the US that you're excited about?
Wow, that is like an action-packed question.
Yeah, it's kind of loaded, sure.
Where do I start? So for surgery, I thought it was really interesting. I lecture oftentimes about surgery and threads and non-invasive modalities. And I always describe threads as something in between a needle and a knife.
Mm-hmm.
And then to sit on stage with these amazing facial plastic surgeons of the world, and for them to say, almost 100% of the time, they're now operating and doing deep plane facelifts and doing threads at the same time.
Mm.
So it's not either or, they're doing both at the same time.
Yeah.
And I thought that was kind of interesting because, why would you be doing threads if you're doing a full deep plane facelift?
Right.
And it makes sense because when we do a facelift, oftentimes when we placate the SMAS or when we put in permanent sutures, it holds everything up, right? And it kind of bolsters everything. And that's where the healing in the scar tissue is going to go. And so it holds its place and all of this. But they have these silicone threads and these, we have PDO threads, as do they. And what it does is just reinforces and makes their healing process more tight, and kind of holds the position for longer. And the
almost
results,
like a compression garment would after like liposuction?
Except,
okay.
Yes, actually, yeah. So imagine for the first 6 months, kind of keeping all of that in place while it's healing. I mean, pretty phenomenal.
Yeah. Because, the deep plane facelift is going to try to bring things back to the natural vectors, of youth. Mm-hmm. But that does make sense because you do have swelling some afterwards, obviously, right?
Sure. And you have movement.
Right. Right. That makes complete sense. And again, that's not something, I'm sure that it's been something that's been talked about, but over here, it's not something it's either or, right? It's like, it's not and, it's or, right?
Yeah.
There was a commercial.
Like I said, I always say it's in between a needle and a knife, which is in between fillers, kind of when you max out on fillers and the person's not quite ready for surgery or doesn't want surgery yet. That's my sweet spot for threads. Mm-hmm. But the fact that they're doing it together is kind of awesome.
It is cool. So do you have to go through anything additional? You know how to do both, right? So like how are you going to maybe try to incorporate that here now?
I don't know. That's a loaded question.
Yeah,
'Cause
that is too.
ever since I got home in late, beginning of February. I think I flew home February 1st, and it's only been a month and a half. And the last couple of weeks that I've sat down to do a facelift, I'm like, is this the time that I incorporate threads into my facelift? I tried a little bit. We'll see how it goes.
Yeah.
Because that's what it's really all about. Is a lot of people think you only have one facelift and then you die beautiful. It lasts for the next 30 years, but that's not the case. And the thing that people don't realize also is that it's very difficult to really treat the nasolabial fold, that really deep nasolabial fold, with any kind of facelift, right? And I think that that's where, again, these kind of supplemental threads at the same time as surgery really do help. So I tried it on the last couple that I did these last couple weeks, and we'll see how. So far they're doing great, but 1 month out of facelift, everyone should look great. If they don't look great then,
there's something else that we need to talk about.
Yeah. That's exactly right, Paul.
Yeah.
There's something else going on.
Yeah.
We were actually laughing last night. We were, at conference talk at, ASAPs, and we were saying, some of these surgeons that say I do 10 to 15 facelifts a day. And you're like, you're either doing a really shitty facelift or you're not. There's no way.
Yeah.
And even if you're very quick and you're very fast and or can turn it like no other, it doesn't matter. That mental acuity and the thought that's going into the procedure itself, there's no way that you're going to be able to give that much effort and energy and thought into 10 a day. No way.
No, there's that age-old adage of measure twice, cut once. But with the face and tissue, it's measure 17 times, cut once, right? So precision, focus, the attention to detail, those are all things that are critical if you're looking for results, right? Obviously.
Well, it's so funny because, that's exactly right. When I do any procedure on a patient, the days leading up to it, I have kind of a mental picture of what they look like now and what I want to make them look like afterwards. And if you don't have that vision to see the before and after before you go in there, it's not going to ever be, you're guessing, right? You have to have a plan when you go in there. The first thing I'm going to do is this. The second thing I'm going to attack is this. This is what's really bothering the patient. I need to make sure I bring up the jowls. I really need to maybe do a little liposuction here. A little bit of
that transfers.
Yeah.
Right.
Repositioning. Right.
And it's just there's so much to be said about visualization in lots of different things. In sports and athletics, they talk about it. On a previous episode, we had a international soccer player who's also does a lot with social media, and talked about visualizing. And when you're a kid that plays sports, you've always put yourself in that place where it's bottom of the ninth, World Series. You're visualizing it, and it's even the phrase when somebody says, I can't see myself doing that. Psychologically, people have to be able to see themselves doing it before they can fully receive it and do it, I think. And
I never thought of that. That is, that's really good. I didn't think of it. But you're right.
And I think for you, it's almost like if you're likening what you do to the sports arena, it's you're getting mentally prepared to do what you want to do. And you've practiced, you've done it a bunch of times, but it's good to have that plan when going in and what you want to see, right? Now, again, I would imagine that what comes with skill and expertise and, and years of doing it is that not everything goes to plan, right?
No.
So
I say to my staff every day, you signed up for something very different when you come here. You didn't sign up to work at Nordstrom, right?
Right.
And every day is a different day. And every day you go to work and you have no idea what's going to happen that day, no matter how well you plan. And that's kind of the fun of aesthetics, right?
That's what I love about it, right? Because I know that it may be a certain personality type can do this, but I wouldn't want to be doing the same thing over and over again every day. It would drive me crazy.
Me too.
Yeah.
Me too. Well, and it's so funny because people always ask me, why do you go to so many conferences, do I like to speak, publicly and all this. It's not that. It's that every single conference, I learn so much.
Every time.
Whether it's the hell I ever want to do that, or oh, that's interesting, that probably doesn't really work, and or something like the facelift with threads. It's like, huh, should I really be doing that? That's kind of weird. Never thought of that.
Yeah.
You know?
That's why one of my favorite meetings to attend, since we're on the meetings and the
Yeah.
conference things, is Jeff Dover's controversies, right?
Yeah.
Because the nice thing about it from like a person that does product development and different things is that we actually get to sit in on the sessions. So we get to hear at the same time a lot of these new things that you all are learning and doing that we don't get to like be
Totally.
behind the veil a lot of times, right?
Absolutely. I mean, product development, that I feel like if anyone in aesthetics, if they had to pick another career, it's like that's what we love, is that the innovation, that constantly changing, the constantly keeping up with all the new technology that's getting better and better. I mean, as a surgeon, it's so interesting to me because I think especially so I've never been to ASAPs. This is my first year
time?
because
wow.
I'm oculoplastics. They only traditionally have.
Yeah.
But, I think a lot of them sometimes poo-poo like the regenerative stuff and the skin and the lasers and treating because they're like, I just want to be in the operating room. Well, so does that. Everybody wants I want to be in the OR all the time too. But there is something to be said about not being able to give your patients the best results if you don't address the skin, and especially for not giving them the tools to maintain what you've done.
Well, it's even prior to cutting or doing treatments, right? You want to make sure you have the best canvas and surface possible. So even,
Absolutely.
if they're not on medical grade skincare,
That's right.
Getting them on medical grade skincare, making sure they're hydrated, like some of the basics so that you can optimize outcomes, pun intended, right?
Yes.
For the patient,
Yes.
right?
Yes. 100%. Yes.
So with these different things internationally that you get to see, like the threads and the facelift combination, how do you evaluate and what makes sense to try to bring into your practice? Like what is the thought process, and like how do you make sure that that's something that you feel like you'd be able to do? Like right now you said you're kind of like teetering on when do I do it, when do I not do it? So how do you, when you're learning about these new things, how do you go about evaluating what you should bring in?
So I personally have evolved in my screening process. So I think my first thing I do is I think number one, does it work? Is it effective? And what kind of patients would it be best suited for, right? So if I can picture that patient and what this product or technique or whatever is perfectly suited for, and I'm excited to do it, right? So I think that's number two. But number three, do I like doing the procedure? So there's so many times that, so I have a second master in my house, and then I have a guest. So I have two spare, and thank God we have two extra, because everyone's like, what do you need two extra bedrooms for? You have that many guests? And I'm like, no, not at all. My second bedroom, I joke around, I call it the room of bad decision making.
So you have to explain what that is.
That is the room of the crap that I've bought in the past that I've spent so much money and I can't part with because it costs so much darn money that it like kind of hurts to, like, so I don't want to throw it away, and I can't sell it to anybody because nobody wants to buy it. But I either didn't enjoy doing the treatment, it took too long, it was too painful, it didn't give the results that it said it did, all of these things. So I think I've become either grumpier or more, I guess, focused on does it work? How quickly does it work? And do I enjoy doing the procedure?
So for people in our space, right, what somebody new, that's looking to get into this, resident graduating, different people that are looking to get into this field, right? What would you say some of the pitfalls or like, the room of bad decisions, like what do you wish you knew?
Yeah, you don't want I'm telling you don't want a room of bad decision making. My husband, every time he walks by, he's like, we could be using that room for so many better things. Like you could have a home office. You could.
So what is it that you feel like you said you evolved and you learned, through experience that you could give advice to somebody that could help them avoid it? Like, have wisdom based on your knowledge.
So I think when you're young and inexperienced, I think that you either do something or you try something and you're like, maybe the reason why I'm not getting those results is because, and you won't want to blame yourself, right? And you're like, well, so and so famous, whatever, gets these amazing results with this product or this device. And then look at what I'm getting. It must be me, right? But it doesn't actually matter. And what matters is what results are you getting in your hands? So it doesn't matter if you're not whoever or you're not the best, but if you try the device and you're not good at it, you're you might get better at it, but either way, your results are your results. If you're not getting the results that you want to deliver to your patients, that's not the device for you. Get something else that works in your hands, that you understand how it works, that it feels second nature to you. That's what you're going to use every day in your practice. Because if you don't like, every time you're like, let me try it again, like you're never going to use it.
It's interesting you say that because, like, speaking at different workshops with product and being a part of working with products and demonstrating them, like, I think one of the things that people don't look at is ergonomics and how it feels in their hand.
Yeah.
And is this something that's heavy? Even if it's something that you're looking at delegating, right? Is this something that I want this person doing all day long? Is it going to cause them to have shoulder problems,
Yeah.
right?
Yeah.
And then second, do you feel like there's a difference in also your ability to use it based on the company you partner with? Because some of that probably has to do with continuing
Training,
education and training,
probably, yeah.
right?
So I know a lot of times, I just want to bring up one point, but and then I'll get to your point.
For sure.
I think a lot of people buy machines based on their staff. Like, oh, this person in my staff is going to be performing this treatment. I'm not going to be doing it, but I'm going to buy it for this person. You don't ever want to have to depend on anyone else. You don't, then you get tied to this person, doing this procedure. And then if they leave, if they want more money, if anything happens to that relationship, you're stuck with this device that you're going to be still paying off when they come up with, the better version the following year, right? And that's a terrible feeling. So that's obviously something that I would tell people not to. But going back to what you were saying, that, devices, when you partner with companies, I think the relationship with the companies makes everything. Your rep, your relationship with the company, whether you speak for them, whether you don't speak for them, if you can call them, or if they, a lot of us, especially post-COVID, have a lot of turnover. And, whoever was the expert at the device that, that used to run it, if you could just call that company and say, hey, listen, can you give this new provider a quick rundown and get them up and going? Like, that means everything. Like, that's worth it every day of the week. Like, who cares about, at that point, how much you spent? What matters is, are you getting your money's worth because they're giving you the customer service that you need? Are they helping you market it? Are they helping you? A lot of companies, oftentimes when you buy a machine, it's like they market it so well that they're driving people into your practice. I speak for a lot of devices, and I love that when some of the companies say things like, oh, well, this machine is going to bring a whole new demographic and drive them in your office. And I'm like, that sounds great and all, but I never buy a machine based on that. Like, there's a lot of these like vaginal machines and stuff like that. So that's what I'm talking about when people tell me that. And I'm like, that's great. Who doesn't want a whole nother demographic being driven into my practice? But I wouldn't count on that. What I count on is, are there my bread and butter patients that have been with me for 10 plus years that come in every month for something? Can I use this device on them? Because those are the people you're really going to be treating with whatever you buy, right? So, buy it for them and then expand it to other people.
Right. I agree. I mean, and it's also one of those things where, I've sat down with people plenty of time when they're evaluating different equipment from different providers, different companies, and you hit the nail on the head with one thing that always is a common talk track for me, which is I'm like, look, if you're not excited about it, you shouldn't bring it on.
No.
Right? Like don't, even if you're justifying like you have a hole in your offering or a gap in your offering, if you're not excited about filling it, don't do it.
Yeah. I even take it a step further. If I can't pre-sell 10 treatments to my patients, I don't get it. Even if I'm excited about it, because I'm like, if I can't even sell it before I get it, and I'm this excited about it now, like I'm never going to sell it. So I have a question for you. So if you had to like tell a new provider, lease or buy, or what would you do?
So again, I think that's a great question. Again, we're gonna we're gonna play tennis with loaded questions, right? So I would say it's difficult to, again, sometimes box that into a general statement. But what I would say is that one, you have to look at, do you need write-offs for the year? Right. I think when you look at it from that standpoint, because
that's a good call.
You do have, when you acquire new equipment and anything that you do for your practice, you have the Tax 179 exemption, right? Where up to $1 million of improvements or equipment you add new into your business, you get whatever bracket you fall in, like write-off reduction that year. So I would say that.
But does that mean that you actually get the equipment for?
If you do what I would say.
Because I do it. And of course my tax accountant is.
Well, if you need the write-offs, like that's why most accounts will look at it two ways. Is that one, if you need the write-offs for that year, you write it off that year, because how all of the, the financial leases are typically done.
But does that mean you just get the equipment for free?
No, you're basically writing it off that entire year.
Okay.
Right? The whole amount. Or if you want it and you need it as an operational expense, they'll tell you to do it as a monthly payment, and, don't write it off this year. Just use this as and amortize it over the term of the agreement, and use this as a monthly business expense. But those are really the two sides of it.
Right.
And either way, you're
clearly, I don't do the taxes.
Well, no. And again, it's
I stay in my lane. I know what I'm good at.
Well, you listen, a good head coach has good assistant coaches, right? So you want to have people that you don't have to be the expert in it. You want to know enough to be dangerous, and then, let the expert handle it, right? Yes. That's why people come to you, and they're not doing their own deep plane facelift.
That's right. That's right. Stay in my lane, right?
Right. I mean, and again, it's, that's why specialties exist, right? And, but again, I would say that most people are not necessarily buying the gear outright for that reason, right? They're either way they're doing. We don't really have what's called a dollar out lease anymore, but it's basically that's what it is when you're doing equipment financing.
Right.
And either way, I think it makes more sense to play with house money than it does your own money all the time, right? If you need to write things off, because sometimes accounts will come to people.
I'm a gambler. I love that.
Yeah. Right? So I think that sometimes it's one of those things where accounts look, you have to spend $150,000 or you're going to get taxed. Yeah. Then buy something if you have to, right? But for the most part,
it's aesthetics. There's always something fun to buy.
For sure. So that's a great question. So back to the treatments and things international. Let's just go a different angle. Is there anything from the past that you think about and it makes you cringe today as far as treatments go?
Oh my God, so many things. Where do you start?
So what's one that you feel like is something that is just totally cringeworthy, that was something that used to be this popular thing to do, and now it's oh my gosh, I can't believe we did that. When we go back and look at hairstyles, when we look at as we were growing up, did I think I looked good?
Yeah, right. The perm, the poodle perm. When did we think that was
I
good?
don't know. My dad had a perm in the 70s, and I saw pictures of him, and I was like, "What were you doing?"
I have prom pictures of my hair fully poodled out, and I'm like, "Ugh, that is the worst look ever."
Yeah.
Yeah, I don't know. And remember how damaged everyone's hair was?
Oh my gosh.
Terrible.
So bad.
Bad.
People putting sun in, and letting the hair get destroyed by the sun.
Yes.
And
orange hair.
Oh my gosh.
So there are a couple things that I look at that I'm like cringy. So number one, I understand everyone's big. It's so funny that now I do so many thread lifts because as a fellow, I think you're too young. I think I'm a little older than you, but we spent most of my residency and fellowship like pulling out these permanent threads that they had this like 1-800 number that, and what they would do is they would do these like facelifts that we would open it up and do kind of like a mass plication, and then they'd put these like these permanent threads that used to just eventually erode through the face. And so, you'd start seeing it and people would be like, I think there's a pimple, and it's like a silver pimple. And you're like, no, it's probably not a pimple. And then you open it up and actually, I want to know if I'm sure she's seen a bunch of those too. Remember that? What was that? It was 1-800. It was something.
Oh, yeah. Okay. Yes.
Yes. And that's why I feel like everybody was like against thread lifts, including myself, before I really understood that these are dissolvable and, they go away after, 6 to 9 months inside the body and stimulate collagen and all the good things. What else is cringeworthy? So I had a cool sculpting machine a long time ago and long time ago. And I figured out early that there was a lot of hypertrophy of fat. And so
the reverse adipose hyperplasia.
Yes.
Yeah.
Yes. So I did a lot of lipo for free to get rid of. So that was kind of annoying. I also thought, what else was cringeworthy? Whatchamacallit, Kybella. I was one of those.
Frog.
Yeah. Well, that wasn't the worst part.
Yeah.
The worst part is the skin retraction that they reported wasn't as much as they had initially said to us. So I had a bunch of 20, 25-year-olds that came to me that had excessive submental fat, and I dissolved it, and they had these necks that looked like old ladies because they didn't have the nice skin retraction that they talked about with the dissolving of fat. When you dissolve that much fat, you're going to have skin laxity.
It's interesting. You bring up a good point with that. And again, like, I don't want to throw shade on anybody, right? But at the same time,
when it worked great.
It did. And if you looked, but just peeling back the layers of the onion a little bit, I recall looking at a lot of their before and afters, and they were youthful faces. There wasn't a lot of people in their late 30s, 40s, and 50s that they had before and afters for, showing that retraction.
Yeah.
Right. And I feel like that's why those results were obviously the way they came out, was because they had submental fat, right? Yeah. But they also had youthful skin that could show that retraction quicker.
Yes.
So did you find that you had to, because patients were upset with it afterwards, did you end up having to do something for them, or did you just end up selling them another treatment, or how did that work? Because
no, I mean, thank God I operate. I'd make an incision, I'd do a platysmoplasty, take out the excess skin, and be like, I'm so sorry.
Yeah.
A lot of them are still my patients, which, I love my patients. Obviously, you got to, you can't take a dump and not clean it up.
Right. For sure. It like, and that's the thing, again, like, I feel like is so important. And I've been blessed and lucky to work with a lot of physicians of the same mindset, right?
Yeah.
And is that make it right, like there's in that, even not everything's going to go perfect, but when you correct something, expeditiously, when it does happen, you do have a patient for life. And like you said, these people stayed with you, you apologized, you took care of it. It's like, look, at least you did get the fat reduction, but the retraction wasn't what we thought. I'm going to take care of it for you.
Yeah. Yeah. Yeah, but that wasn't a fun time.
Yeah. No.
What other crazy things did we?
There's been a lot, right? I mean,
Right.
there's so many different things. And I think that's what can be confusing to people, right? Especially like the consumer versus the people bringing in the devices? Because, from a device company or a skincare company, they have two markets they're trying to target, really. You've got the physicians or the practices looking to bring in their product, and then also the consumer messaging, right?
Yep.
And I think that's one of the things that, again, one of the main reasons why I wanted to start this podcast was to bring authentic, factual, science-based information in different ways to, people in our industry as well as the consumer, so that there's a lot of smoke and mirrors. There's a lot. You got to wear your waders sometimes to go through things to find, what's the real thing. Similar to you, like you mentioned, that room.
I think it's pretty hard to be a guy, to be very honest, because I feel like I have to try things on myself to see if I like it. Does it work? Does it smell funny?
I'm a biohacker, so I will always try things on myself.
Yeah.
And I think a lot of us that have ended up doing product, like in development, if you look at our hands, there's always like scars where we overtreated ourselves because we were tired of firing on test paper or porcine skin. We're like, I want to see how this goes. And you're like, well, that was a little bit too much, right?
Right.
But we have something that can fix it.
That's what you have to do as a good provider, right? You have to push the limit and see how far you can take it. And sometimes you do take it a little too far, and that scares all of us, and then you have to put on your big boy pants and you do it kind of in the interest of science and for better results.
Well, that's the scientific method, right? I mean, that's what you have to test a hypothesis to see if it's going to work.
Right.
Right.
Right. It's so funny. I was in a board right before this, and one of the physicians was advocating for no studies. And I was like, I understand what he's saying. He's saying just give really good quantitative before and afters and show them to providers. But we do really want to see the studies at the end of the day, you know? And so, listening, I let him go and go and go. And then I'm like, okay, let's just dial it back for 1 second. None of us would buy anything if we didn't have any studies.
I mean, again, results speak for themselves, but you got to understand the data, because also, even for me, like I can see something and I can understand the concept, but it makes it 1,000 times easier when you can show me the actual data of how that result was achieved.
Right.
Right. So thinking about that in the same respect, right? With you've been great in introducing and pioneering like new treatments like exosomes and even now Latibo, right? The new Korean neurotoxin. So how do exosomes and like Latibo differ from other things that are used for that?
Well, like I said, you're the expert on exosomes. I actually got a lot of my stuff from Dr. Duncan.
So for those of you watching, she's pointing to Dr. Diane Duncan over here. Like we'll bring.
I dragged her along.
Yeah, we'll bring her on again so everybody can see who we're talking to in the peanut gallery.
Paul has a peanut gallery. When he has his podcast. A very famous peanut gallery. So exosomes is, it's so interesting and exciting. All of this regenerative medicine, I think it's breathed life into aesthetics in so many different ways. And I love that it's even trickled down to our consumers, which I think our patients are coming in asking for exosomes. They're asking for PDRN. They're asking for all of these exciting things. My biggest thing with exosomes, and, like I said, Diane's the expert, but I think it's hard with exosomes because we just don't know what it means. We know it does something great quantitatively. What does it mean? Right? It's like, it sometimes works great on some people, sometimes doesn't work great on others. There's one thing that Diane says that every time people present to me new exosomes that are topical, she says, you can't actually get an exosome to work on if you just throw it on top of the skin. You have to make some sort of injury or inflammation.
Some delivery mechanism.
Right.
Yeah.
And there's so many providers that I know personally that use exosomes topically, and they don't do that. So it's not doing anything. And so I always think that's so interesting that, there's, off the top of my head, 3 skincare lines that sell that have topical exosomes,
Mm-hmm.
and they are convinced that they penetrate through skin without any sort of injury to the skin.
Mm-hmm.
And again, we don't really know that's true. So that's I want to be able to, just like Kybella, I feel like it worked great on some people and then didn't work great on other people. I want to be able to give you a bottle, sell you a bottle of skincare,
Mm-hmm.
and this is going to do X, Y, and Z. And I could sell it to everybody and tell you, this is what's going to happen. This is
the outcome you can expect.
Yes, I want consistent, reliable results every single time, regardless of everything else.
So do you find that you're injecting exosomes for any reason?
No.
Okay.
No.
All right.
I don't want to get arrested.
Right. Well, I mean, I know that like with
I don't look good in orange. Orange might be my color.
Sports medicine in a lot of different areas, they will do injections to help regenerate tissue, right?
Yes.
So theoretically, again,
I don't get me wrong. I sell lots of exosomes.
Yeah.
I do microneedling. I do microneedling RF with him.
Yep.
I do erbium YAG. Fully ablative lasers, and I drive it into the skin.
Yep.
That's oftentimes when I'm closing a wound. Sometimes I love PDRN, the salmon sperm.
Yep.
Fantastic. I think all these peptide things are really.
Yeah. I mean, I
are you sold? Are you?
Oh, yes. Yeah. I mean, well, myself, right? It's hard to see right now, but I tore my meniscus, and
oh no.
Do
you have surgery?
I have surgery scheduled in like 2 weeks, but I got in the injectables from prescribed of BPC 157 and TB 500 because they're massive tissue regenerating, and I used an insulin needle and injected because I had damage to surrounding tissue that wasn't like torn.
Right.
But I mean, it made me feel better within 2 weeks, the other areas that were sore.
Yeah.
I mean,
well, Shino got, I think, platelet derived growth factors. I think he was dancing. It wasn't due to the videos on Instagram.
Well, he always dances.
I know. Everybody wants to blame me for the 2 videos we did, but it was not from those 2 videos. But it helped quite a bit. And that's what I think is so crazy. For some reason, I'm not sure why the FDA doesn't acknowledge, the vast science that's behind all of this regenerative stuff that we're just bringing into aesthetics now, but have been in wound healing and orthopedics and all these other areas for how many years, even though, I still refer to like my neuroscience papers when certain things about Botox, right? Because we have 3,000, papers, publications on neuromodulators, how they work, how they don't work, resistance, and everybody thinks it's like something new and different in aesthetics, but it's not. It's something that it's the science. We go back to clinical studies that 20, 30 years of the number one indication for salmon sperm is a diabetic foot ulcer, right? So if it works on a diabetic foot ulcer,
shouldn't it help regenerate tissue?
Yes. And that's why it works in the aesthetic space. So it's like, why can't we transition that? And that in other countries you're allowed to inject, exosomes, the FDA has taken a hard line.
They have.
But I don't know why they wouldn't approve some of these things that are so easily.
Well, the other interesting thing is like when you look at the FDA, and again, I don't want to get on the FDA's bad side, but because I need their approval for things, right?
All of us do.
Yeah. But how long were we using neurotoxins for crow's feet before it was actually cleared for crow's feet?
Yeah.
Right.
Yeah.
So I think
I'm oculoplastic, so I was using it before it was FDA approved for cosmetic. So I did it for hemifacial spasm, for blepharospasm, all of these things. And it's so funny because, what in the aesthetic space, so I graduated a long time ago. And
nobody can tell.
Yeah. That's because I sell the Kool-Aid. I drink the Kool-Aid every day. But, at the end of the day, I started seeing resistance way back then, 2004, 2005, when people are like, resistance, immunity doesn't exist. When we were using, 200 units, 150 units in people that couldn't open their eyelids because they had blepharospasm so badly. Like, this is a functional problem. Like, this is a medical problem. They can't see unless we neuromodulate them so that they can open their eyes.
Mm-hmm.
So, I saw resistance back then. And like I said, when people fight that, you got to look at the other journals, right?
Mm-hmm.
Look at medicine as a whole, right?
Yeah, 1,000%. So Latibo,
Great.
you love it?
Love.
So
What's not to love?
So what is it, for people that are not necessarily familiar with it, can you explain like how it's a neurotoxin, right? It's a neuromodulator. How would you describe this as being different? Or how does, like, maybe as far as application and...
No, honestly, neuromodulators work great.
Mhm.
Every one of the neuromodulators on the market has its little isms and something that differentiates it from the rest of the market. I think as a business owner and a doctor who uses neuromodulators, all of them, I think that, there's some that diffuse more, some that diffuse less. I think Latibo wins with the price.
Mhm.
It works just as well in my hands as all the other neuromodulators. Longevity, effectiveness, does it kick in a little sooner? Maybe. I think that depends on the person too.
Mhm.
You know how some people are like, oh, I swear the next day it started to kick in. Is it in their heads? Is it real? I don't know. I think
Some people metabolize certain ones faster than others, right?
absolutely. Yes. Yeah. And it depends on, how long they've been exposed to the other ones and all of that. I don't think that this is going to be the answer to people that are resistant.
Mhm.
I just think that it's another neuromodulator that we have in our pocket that works really well.
So with all of these different products, like the neuromodulators, devices, treatments, topicals, injectables, how do you navigate when talking to a patient, what's best for them? Because sometimes, again, you mentioned earlier, and again, in this day and age, everybody's got fingertips and
Yeah.
they know what they're looking for. They come in saying, I want exosomes, right?
Yes.
So how do you help them? Because again, your brand and your philosophy is uh, natural looking, confidence boosting results.
Yeah.
Right. So how do you help navigate them towards what they actually need versus what they come in sometimes thinking they need?
I think that you have to develop a relationship with your patient that obviously they trust you. But I also think that at the end of the day, a lot of people come in and they're like, I want this, I want that, I want this. What I always break it down with what's bothering you,
Mm-hmm.
what's the problem, and this is what I think is going to be best to address your problem. But again, at the end of the day, we are a service business, right? So if someone wants something, obviously if it's going to look crazy, if it's going to look ridiculous, if it's going to look fake, if it's not something I believe in, I'm not going to do it. But if someone's like, you know what, I prefer this over this, and it's not going to make a darn bit of difference in their results, I'm happy to use it. Because, I think that any provider that says like, oh, I do whatever I want and I don't let the patient help guide their treatment, I think that also makes the patient not like you as much
Mm-hmm.
because it's a working relationship. Like, you have your opinion, I have my opinion, and then we come together as a team to come up with a beauty plan. And if you can't respect your patient's opinions to a certain extent, then you're probably not the right fit for them.
Mm-hmm.
You're not their doctor. They haven't found their person,
Mm-hmm.
so they should go find their provider that matches their philosophy or their vision of what they should look like.
So it starts, I think, like you said, with the relationship. And that's sometimes people would say that's cliche, but it's the most important part, right? I would say
It's everything.
It's because, again, if you look back in when medicine first started and you evolved to where it became a doctor did house calls, right? They didn't
Yeah.
necessarily have offices, but that doctor was local. So they knew their patients already.
Yep.
Right. So they knew if something was off with that person because they saw them regularly.
And you know
right?
what? It's so funny because like you say that, and that's absolutely it's a lot of my colleagues are like, I don't even like to see consults. I just like to operate, and I think in their mind, they want me to think they're badass. But to me, it's like, wouldn't operate on anybody that I haven't like talked to, haven't treated, because you don't know, in today's day and age, I think you don't understand what the patient really wants to look like until you work with them for a little bit. You get to know their aesthetic, what they want to look like, what their goal in their beauty journey is. And part of being a doctor is that relationship. That's the fun part, right?
Well, I think that's the difference between average doctors and great doctors. Like I've said this when I've been on panels before. I mean, I've worked with some phenomenal people in my career. I've been lucky.
Yeah.
But I've worked with a lot of different kinds of doctors, right? And I've said this before on this podcast is that the difference between an average doctor and a great doctor is they give a shit. Right?
Yes.
I mean, is that they're asking the third, fourth, fifth level question. How does this, it's
actually, you know what? We were having this conversation in the car over here. What makes a good presenter at a conference?
Mhm.
And it's at the people who give a shit, people who go over their slides before they get there. When
I'm somebody that like tweaks the same presentation 75 times, even though when it's right, because I just feel like there's something else I can do better. You know?
And you want to, even though you want to give every single person something valuable to go home with, right? That's the reason why they see you. That's why they show up. I've heard Diane Duncan speak. Oh, I've heard Dr. Barbara, I've heard whoever it is, right? But what makes you go see that person again is because they're going to say something different that resonates with you.
And that's why it's so great attending the conferences, right?
Yep.
Because sometimes, and I agree with you 1,000%. Like every time I go, even when it's the same ones year after year, I learn something. I make a new relationship with somebody.
Yeah.
And sometimes I get to hear somebody explain something I've explained 1,000 times, but they do such a good job of explaining it. I'm like, wow. I'm incorporating that.
Yeah, I'm going to try that.
Yes,
I'm going to see how that goes.
Yes.
Yeah.
It's because one of the things my father always told me when I like growing up that ultimately, if you're communicating with people, if you're explaining something or you're trying to connect with them on something and they don't understand you, it's not their fault, it's your fault.
Yeah.
You have to learn how to meet.
I never thought of that.
You have to meet people where they are, and you have to be socially aware enough to know who and how you're talking to somebody and be thoughtful in your communication, right? So you can say the same thing.
I have to be more thoughtful in my communication. Sometimes I feel like.
Well, I think that sometimes when you're right about something, sometimes it's hard to try to influence somebody when you're just like, just listen to what I'm telling you.
Yeah,
right?
Exactly.
You're sitting in front of me because I'm the expert, right?
Yes.
But it's definitely
you don't need Botox. That's not the problem.
Right. And I mean, I think sometimes like I find that with some treatments, like some of the younger generation will come in thinking they need Botox, but they really want a laser facial because they want their skin to pop.
Yeah.
Right. They need that's what they're looking for. Not necessarily, this influencer told them they needed Botox, right? It's like, no, this is what you're looking for. And again, it's those third, fourth, fifth level questions, right? It's like how do you meet them where they are and get them to pull out, like they say the best psychiatrist is the one inside of you. Somebody that's a good talk therapist is going to help draw those things out of you just through questioning, right? Yeah. So it's one of those things that constantly is something that comes up, but I think that most of us, especially when we're passionate about what we do and we know what the right thing is to do, sometimes you just want to get them to get to the answer faster. And I've found that, again, I've always tried to take a step back in those situations, and I can hear my dad saying that in the background. Remember, meet them where they are.
Yeah.
And I think that's helped me personally.
No, that's great. I always try to remember the phrase, speak less and listen more. Because I feel like I enjoy talking to people and I enjoy engaging with them, and I think that when I remember that, and I'm like, listen more, speak less.
Mm-hmm.
it always, I always learn something new, and you would think I'd be a lot more quiet, but
Well, I mean, it's one of those, look, you're passionate about what you do, right?
Yes,
And
I love it.
I would say innately somebody gets into medicine because they care about helping people,
Yeah.
right? At the end of the day. And I
I
know,
think everyone deserves to look beautiful or look like the best version of themselves.
right, like, they're look how they feel,
Mhm.
right? And like, I mean, again, that's always a topic of conversation. And it's, that was one of the things for years that took me a while to jump headfirst into the space, because I always thought it was about vanity, but it's so much more than that.
It's so
right?
much more than that.
I've worked with this with people that had where we helped get rid of scars because they were once cutters.
Yeah.
Right. And like being able to, when they look down, not have to see those things anymore. It's
Yeah.
transformative for
It's
people. Right.
transformative.
And
Actually, I have a good story. I have a patient that right before I left, so he came into me for upper eyelid surgery and lower eyelid surgery. His wife had just passed away. She was on hospice for like a year. He was, and honestly, the reason why he did the lowers because he's like, I look like I aged a million years. And he's like, but the uppers, like, I just can't even see anymore. And, it's not going to fine. That's perfectly. And we did it. And he has come in for neuromodulator and just, facials. And I've kind of seen him over the last year. And now he's engaged. And now he sent in his new bride or bride to be to get a little fixer upper before they get married. And I'm like, wait, you're engaged? And he's like, I know. And he's like, don't judge me. And he's like, my realtor set me up because she's like, you're such a nice guy and you lost your wife. Now you've got to start getting back into the game. And he's like, and after you did my eyelids, I started feeling like, a normal person again.
that's a perfect example though,
Yeah.
right?
Yeah.
It's like that got to be his self again,
Yeah.
right? So that he could put himself out there and, see what the universe had in store for him. Right?
Yes.
And
Yeah. Well, it's so funny because I was telling my medical esthetician, I'm like, Betty, you should go out with him. And she's like, his wife just died. Like, let him do her funeral first before you set me up with it. And now, and when he did come in, he obviously looked much older before we did his eyelid surgery. And then afterwards, he looked great. And now he looks young and, good looking. And his fiance that he sent in to get fixed up is much younger than my medical esthetician. I'm like, boy, you really snoozed and lost.
I'm going to go ahead and break the fourth wall here. And what you're not going to see, because we've got a great editing team, is that Dr. Barberino left, presented on stage, spoke on a panel, and now we're back. Right. So
all in
here
a
we go.
day's work.
Magic of post-production. Right.
That's how we roll.
So we had left off on that patient that got engaged after the procedure, right?
Yeah.
What
I love that. It like comes all full circle.
Yeah, how you were saying, like we were talking about psychologically and emotionally, how having the outside match the inside, and it allows for more than just like aesthetics and medical aesthetics, and surgery is more than just vanity and more than outward appearance. It's one of those things that can help push things forward, right, for people.
Yeah. What's the saying that I always say? We might not be saving lives, but we're making them better every day.
Yeah, that's great. It really is. I mean, I think that, and if people, I follow you, I know other people follow you, and if people start to follow you, they'll know that
please follow me.
Yes, please follow her. We'll make sure that the socials are up at the end.
Yeah.
Because if you don't watch her socials already, she does a lot of fun things, and she has a really unique way of bringing things. And again, part of your brand is that. I mean, I think it's very authentic as far as you really do care about what you're doing. We were speaking about that earlier, where it's, the difference between an average doctor and a good doctor, and you clearly are that,
Thank you.
Speaking about socials, you do such a a fun twist on things. Like,
Thanks.
how is it that you came to navigate the social media world, and how are you utilizing it on a regular basis?
It's so funny because everyone's like, "What's your social media strategy?" I'm like, "I don't really think I have a strategy, to be very honest. I probably should get one, and at some point I will." But I when I first started to kind of get into it, everyone always said pick 3 pillars that you want to hit, and my pillars I think are um, to educate, um, to laugh and make others laugh, make me laugh. And number 3, to entertain, because I feel like, and engage with other providers.
Mm-hmm.
And I certainly feel like I hit all 3 of those pillars all the time. So,
Mm-hmm.
at some point I am going to get serious and have a strategy for my social media.
I think you're doing just fine, right? And again, I think the thing about social media is, it's digital word of mouth, right? And word of mouth is still always the best kind of business that you can get. And
Yep.
I feel like people do things to follow trends, and that's great. But you're authentically you, and like it's like, this is who I am, and if this is what you're about, then you should come here and work with us, right? And I don't think that I think that's why you've grown your following, and you will continue to grow your following. And with that, I mean, social doesn't necessarily skew ages, but it does have the younger audience is easily reached there.
Yep.
It's one of the things I think is interesting. I was on a panel a few weeks ago, and we were talking about this. I'm like, my daughter is 14 and she's all up and down TikTok, right? But what TikTok has done has made skincare be a regular part of that generation's routine.
Absolutely.
Right.
I have an 11-year-old boy
Mhm.
and his best friends. I have 2 gal best friends that have 11-year-old girls that are
Mhm.
his age in his class, and they are all about, like, blush and, facial cleanser and, the latest scrub and, "Oh, Sheila, what do you use for this?" And it's amazing because at 11, I don't think I was into that or even knew about it,
No, I
right?
was using Oxy and Clearasil maybe because I had pimples,
Yeah. Yeah,
like,
exactly.
and it's interesting because it's my daughter before she goes to bed every night. She's got her headband on, she's washing her face, she's
I
doing her
love it,
skincare,
right?
and luckily daddy's in the industry, so she has good skincare, right?
Great skincare.
She's not getting
The
nonsense.
crap, yeah.
Right, right.
Medical grade skincare.
Yeah,
It's always a good
it
choice.
100%. Speaking about skincare, like, are there any particular products that are your go-tos or that you use in combination regularly?
Yes. I think all of us have our favorites. So with every lip filler, I always use the Revision lip afterwards. I think for 2 reasons. Number one, I just think it's a wonderful product to use. It's really hydrating. It stays on, unlike most lip things. I think that it's also kind of a nice white glove service at the end of like a lip procedure. And I also want people to, I feel like you give somebody something to do, and I always tell them to rub their lips together the next, 3 or 4 days. Like they have a new lip gloss that they really love, and people don't really understand that unless I give them a lip product to do that with.
That's interesting. Yeah.
Yeah, but I think that it's, anytime you put filler or do anything to the lips, you're gonna get some bruising and some swelling. I mean, it's infamous for that. But I think massaging it, you don't want to massage it aggressively because you don't want to move the filler. But I think that just kind of a light massage with your own lips is a very healthy thing, and it makes the bruising and swelling go away much
Mhm.
quicker.
I mean, it's one of those things too that I think people neglect a lot of times is post-care, right?
Yes.
And it's, you know, people have said that, in the past that I've worked with, and I'm sure you can probably, you know, hang your hat on this sentiment too, is that, the procedures that we do are only as good as the post care. I mean,
Yep.
you can lead a horse to water, but you can't necessarily make it drink, right? And it's
Yes.
one of those
Yeah.
things that
100%.
I'm sure on a regular basis you have the post treatment products that you would tell them that you recommend. And I know a lot of
Yep.
people now are just not even making that optional. It's part of the package. Yeah.
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 So like, I have a lot of higher skin type patients that, um, you know, we're working on their hyperpigmentation and their fine lines and wrinkles. And so I often have them pre-treat with either some sort of vitamin C product. I love the SkinCeuticals, because they have the vitamin C ferulic, they have the Silmarin, they have the Floritin, and then at nighttime I have the higher skin types tend to be more sensitive. Actually, 30% of Asians and South Asians are allergic to skincare, period, versus a Caucasian who's occasionally 10%. So it's significantly more reactive than any other skin type. But at night, I have them do a retinol, like the elastin retinol, which I feel like because of the nanotechnology that it's microencapsulated, so it goes past the skin surface without that redness and irritation and the flakiness that
the trihex piece to it, right?
Yes.
Yeah.
Yes. It's a great. I feel like if you can take a real retinol any day of the week, fine, you can use whatever you want. But I feel like there's a lot of us that are really sensitive. Like if I used a retinol last night, I will look like a hot mess today.
Well, and I think too, some of it, again, looking at the wellness side of it, is there are particular cultures that have an aversion or an allergy to ingredients, right? Like
certainly,
as far as gluten sensitivities. I mean, I'm somebody who haven't had gluten for 14 years because it was something I had to eventually cut out. I had all this inflammation and I didn't know why. And I went under twice and they said there was nothing wrong with me until we started doing more digging and getting more data, right? And we were talking about data earlier with studies and everything, right? So, I want to bring it back really quick, back to the social media piece in that younger audience. Do you feel like, in a good way or in a bad way, and this, again, we're playing tennis with loaded questions again.
Yeah, I love these loaded questions. You're like, answer this. Solve world peace.
Yes, yeah, right now. Go ahead.
Done. Easy.
How do you feel like that's shaping some of the perception of beauty standards, right? Social media and how the younger generation's receiving it. I mean, we talked about my daughter skincare is now, on a positive note, been part of her regular routine.
Which is good, but then there's the negative, because I feel like people are really looking at themselves and altering their appearance, and they want filler earlier and younger, and it's just an overall distortion. You know how many times patients come in and they're like, make me look like this filter. And you're like, that's the point, is it's a filter. It is not real life. That is not how anybody can really look. In certain lightings, you can look like that. But in general, that's not a real person, right? So, it's a two-dimensional picture. So I think that, number one, people look better in real life when they're dynamic. And I think that's also one thing that people don't see, right? When you look at bad pictures, you can always take a bad picture, right? But then you see yourself in a different lighting and you're like, actually, I look great, right? So I think everyone's really hard on themselves, especially in this day and age of social media. So I think that's tough. But I can say that I've had probably the extremes of social media. The good thing is my social media has really taken off. The bad thing is it has some negative too. I've certainly been.
When you're succeeding, there's going to be haters. That always is.
Yeah,
right?
There's people that try to take you out and say terrible things about you, and that's really hurtful. People think you're bulletproof, and you're not. You're a person just like everybody else. And I think that's balanced with. I get stories all the time that people will email my practice and say, you don't know me, I went through my battle with cancer, and, your social media brightened my day. And it just made, it's like, how can social media have such a powerful effect? And they're like, well, I didn't have anything to do when I was in the hospital. And like every day I looked at your Instagram, it just made me happy. And then it's like, that is a reason to keep doing all of this, right?
It is. I mean, we talked about it earlier. I mean, I think inherently, again, average to great is that you got into this and went through all the hours of school and testing and studying because
just to dance on Instagram. No, I'm just kidding.
No, right. I mean, some people, but I would say really it's because you have a passion for helping people, right? And this is your medium, right? That you get to do it in.
And I get to do whatever I want, and that's I think the most fun, because a lot of people are like, why don't you do more your before and afters? And why don't you do more procedural things? Because you do that. I'm like, that's my day job. Like I love that. And I do want to demonstrate all that. But like, when do you ever get to like put on a costume and have fun with your staff and, make people laugh and have your colleagues laugh? I mean, one thing that I really notice is when I come to these meetings, people I don't know, you feel connected to them. They feel connected to you.
Mm-hmm. I mean, I think there's always positives and negatives to everything, right? But I do think it's a way of connecting with people, and it can.
It's social. It's social media. People forget. It's like, it's not supposed to be serious.
No. And in that, right, I think that, there's a lot of things that can be misconstrued, like you said. With the messaging though, we were talking about my daughter, and let's like specifically young women. How do you feel like young women should look at getting into procedures, right? Like prejuvenation. So you've got, I mean, nose jobs have always tended to skew young,
skincare
right?
is fine.
Yeah.
I think that the fillers and the neurotoxin, it's absurd. I think that as a super vain woman myself, I think that your face and your body change, all the way through when you're, 21. And I think that that's really a starting point, that if that's when you want to start all of this, by all means. But I feel like even 18, I feel like it's a little young, because I feel like your face is still catching up with your nose, and your nose is still catching up with your rest of your face and your body.
Yeah.
And
with that, continuing on with that, when they start to do the procedures, or just in general, like, again, they're going to start doing something and there's like an entry level, how do you navigate? And again, like you mentioned earlier, it's about providing the patient what they want.
Yep.
But how do you navigate when somebody wants something and they're going to look overdone? Like, how do you navigate that conversation?
Well, like you said earlier, is you got to meet them where they're at, right? You've got to meet them where they're at. So if, I have a, 18-year-old that comes in and I want a little bit of lip filler or something like that, I think that, the first thing I would suggest is to maybe do a little bit of, a facial. I think we have some microneedling and some treatments you can do on lip for hydration. You can, but at the end of the day, if they want bigger lips, maybe we start with a very modest lip filler and just a little, aliquot, and, keep it at that so they don't look crazy.
Right. And it's kind of like when you're cooking a steak, it's better to undercook it than to overcook it, because you can't go backwards.
Yeah. Right? Yes. And, the patient's going to be happy. The parents are going to be happy. And, who wants, I feel like everyone's so extreme these days. It's black or white.
Right.
Sometimes just a little refresher, teaches them to be modest with their treatments.
I think regardless of age, it's one of those things where, like you mentioned earlier, you work with them and you put together this beauty plan,
yes.
right? And
I always say that. I'm like, whether you do something today, tomorrow, next year, or never, let's put together a beauty plan so we can figure out where, like, kind of a roadmap and where we're going.
And it's always like, let's do this. I mean, I know that we could probably go and do more, but why don't you see this first? Because they've also never seen themselves that other way, maybe in their head, but like actually having the result too.
Yeah.
Right.
Well, I'll be honest, I don't see that much of that anymore. I'll be honest. I see more of this, like, 50, 60-year-old gal who's never done anything, and they come in and they're like, I want one syringe of filler, go to town. And you're like, wait, like, that's not gonna do anything, and I think that is somebody that is more of the everyday that I'm seeing now, more than, I think probably post-COVID, we saw a lot of that, like, overinflated. But I think that even the younger gals did kind of take that in, saw that people started looking a little crazy and a little much, and went the other way, which is good.
And like you mentioned too, there's things you can do for longer lasting, more natural looking results, like revolumizing with RF microneedling.
Yes.
Before adding fillers. Not that they may not need fillers, but less filler to be more natural.
Yep.
Right. So I'm going to put you on the spot now.
Okay,
right?
let's do it. I love to be put on the spot.
What's the most shocking, patient request you've received recently?
So I had a patient that had a facelift consult with me, and the MA went and talked to her and took pictures, and I looked at the pictures and I'm like, gosh, she looks great. She's never had a facelift. Like, I don't know if I can make her neck look any better. I don't know if I can make her face look any better. It's so tight. Let's go in and talk to her. And I'm looking at her and she just has this like perfect. And I was like, what is going on? And I'm like, I have to be honest with you. You're 60 something years old. You look fantastic. Like, I don't think I can get you anytime. She goes, oh, I have my cheat on. And I'm like, what does that mean? And then all of a sudden she lifted her hair and she had some duct tape from here all the way to here and just pulled the whole thing off. And it was like her entire face. I mean, it was the most amazing thing I'd ever seen. It was like a drape that it all came down. And I was like, oh my God. I think my MA almost like passed out. She was like, we'd never seen anything. It was shocking.
And it looked natural.
Yeah, she had it all hidden underneath her hair. And it was all...
She did an at-home thread, basically.
Yeah, but it was duct tape from here all the way to here.
Oh my goodness.
Yeah, and it was all totally tight.
That is crazy.
It was amazing. I'm like, if you can do that every single day, you don't need me.
That's amazing. I've never heard anything like that before.
It was silver duct tape. It was the craziest thing I'd ever seen.
See, there's so many uses for duct tape, right? I mean, it's the panacea for all things.
It's the Windex.
Yeah, it's right. Spray, it's right. So we've talked earlier, you're known for natural looking results, right? Do you feel like you always started at that point? Like you wanted to have like just try to make people refresh, or is that something you evolved to?
No, I think that everybody can look at people that have done too much and they need to dial it back, right? And I think that it's so funny because my second fellowship was in Beverly Hills, California, and I had so many patients that came in and they were unhappy and they were like, I spent $1,000 on my lips and nobody can tell that I had anything done. And I'm like, oh my God, isn't that so great?
Mm-hmm.
And they were like, no, I want people to know that I had my lips filled. It's kind of like my Louis Vuitton bag. Why have a Louis Vuitton bag? Well, it doesn't say Louis Vuitton, and it's an interesting perspective, right?
Mm-hmm.
I really have always strived to have natural results. So that's why Beverly Hills wasn't my cup of tea. And in fact, I went on and did my third fellowship for one reason only, because so my third fellowship was basically specializing in male faces. And the reason why I did it was because it's really easy to feminize a male face in plastic surgery. And I think that it takes a very special technique to not feminize a male face. And so I spent an extra year. It was so funny. My mom's like, no more fellowships. This is your third one. You're done. Like at some point you need to work and make like a normal living. And I agree with that. But I'm so glad I did it because, you look at Kenny Rogers and people
Perfect
like that,
example.
right? And he really did it because he did it for visual reasons.
It was for comfort and,
he couldn't see.
Yeah.
And everyone thinks he had a big facelift. And, people look weird. People look awkward. People look not like themselves. And that's not why people do plastic surgery. People want to look like the best version of themselves. Yes, there's the extreme that wants to look like Angelina Jolie, circa whatever.
Mm-hmm.
But the majority of the population, 99% of the population, just want to look like the best version of themselves. And I think that for everybody, and I think that men particularly would rather look old and ugly than weird and like they had waxy plastic surgery.
Right.
So the last thing I want to do is deliver that result.
So when you're talking about that with the men, right, and that you took the care to do that extra fellowship. What is it that you found extremely valuable from that? Was it more making sure to check the proportions of the jawline or accentuate the jawline? Like, what are some of the things that you can avoid to feminize a male face?
Well, one thing that I really have noticed about making men the same things that you jump in when you first see a woman to rejuvenate a woman's face is not the same things you jump in to rejuvenate a man.
Hmm.
I think that most women are like, I want to freeze all of this up here. Freezing all of this up here for men really does make them look waxy and weird. Um, to give them high cheekbones is not where you jump in with a man. I really think men, do they have facial volume loss like women? Yes, but in different areas. And again, it's replacing it where they need it versus adding and building the way we would with a woman.
Hmm. And I think the same goes for body contouring, whether it's non-invasive or invasive,
Yeah.
right? Again, if we're looking at it from, masculine and effeminate perspective, right? A masculine preference or natural form is more of a V versus a female tending to have more of an hourglass. So
Yes.
you want to accentuate those natural curvatures of the body when you're doing things, not change them.
Yeah.
Right.
Mm-hmm.
The other thing is we talked earlier about the gentleman that you helped get engaged, basically, right?
I don't know if I did that. I'm not going to take all the credit.
Well, no, I mean, mentally he was at a better spot, right?
He was 100%, and you could see the confidence and, he just, I think anybody that has ever had a family member that has passed away, especially in their home on hospice, it does take the life out of you.
Mhm.
And I think that having something major in his mind, because in my mind, a blepharoplasty is like what I do every day. So it's like brushing my teeth. But I think for patients that aren't used to having surgery every day or doing surgery every day, it's a major, change that just kind of gave him the boost of confidence that he needed to get back out there and just make friends and talk to people again.
Well, there's a lot to be said about longevity. There's different, I mentioned earlier that I'm a biohacking nerd, right? And people that live the longest and the healthiest not only are optimizing what they put into their body, but they have a sense of community.
Yeah.
There's that show on Netflix that talks about the people that have the centurions that have lived the longest, right?
Yes.
And about blue zones, and there's a book written about
Yep.
it, right? And every single one of those pocket communities has a sense of community,
Yep.
and that connection with another individual.
They have the support.
Yes.
Yeah, absolutely.
So with that, when we were speaking with Jay Burns on a previous episode, I asked him this same question, and it was, what was one of the most transformational cases that you've ever worked on, right? And he put it more into a segment of patient, right? So in same question to you is, what is there a particular segment of patient that you feel like has been the most transformational for patients that you treat, or is there a particular patient story that you have that was just really hit home to the heart?
Gosh, I feel like I love my patients so much. So, is there one particular patient? Not particularly, but I think it's always so funny when you have. So, if you guys follow me on Instagram, there was a patient that was fun and funny every time she came in, and she was like that kind of thorn in my side patient that, I liked her. She made me laugh. She's probably not the best surgical candidate at all. She came into me and she was a lifelong smoker. And she was like, I'm probably not going to stop smoking for this. And I'm like, well, I'm going to need you to. And she's like, okay, well, I'll do my best. And, X, Y, and Z. I'm like, okay, but if I operate on you, like, I want you to sign all the paperwork saying basically you could never heal. Like, you'll never heal. You could be an open flesh wound forever. Like, this may never look good. And, she was in tears and she, and I have a lot of these stories. Like, I had a teacher that, I was like, you're an African American woman, like to do a lip lift on you, like you're going to have a big white scar. It's going to be terrible. And, and she's like, so I'm just supposed to not have surgery, and then you're like, okay, I'll do it. But, in the back of your head, you're like, probably not the best case, and it's so funny because after you do it and it's all said and done and whatever the outcome, when they're so happy, it just makes your life better. Like you feel better. And that's the reason why you get up in the morning is to move the needle, right? To make everybody happier. And so the patient that I was talking about the smoker, I mean, literally she would smoke right outside my office and then put the buds out. And I'm like, I just saw you smoking. I thought we quit smoking. Oh yeah, literally that was the first one I've had in weeks. And you're like, yeah, right. And I was like, do you mind if I record you? And just your before and after is so dramatic, and you could see her just get so teary-eyed. She's just like, I look like the person that I thought I was, and she's like, I look at that person in this picture and I don't know who this person is, right? And how many times do we feel like that? Like, who is that person sometimes that you look at, from the outside perspective? You're like, who's that person that looks sad and miserable? It's like, that's not who you are.
Yeah.
And that's not what you want to show the world.
And again, that's the beauty of what you're able to provide people on a regular basis, right?
Yeah.
You're at a conference now, right? You're going to be with me this weekend. We talked about, your
Dynamic
world travels,
duo.
right? And
yes.
so where do you see the trend in the next 5 to 10 years heading in medical aesthetics and, non-invasive procedures?
It's going to get more and more non-invasive and it's going to be more and more regenerative. Like that's the only thing I see, really.
And do you feel like there is, again, more to do with exosomes or what are some of the things that are...
I feel like we're even going to get super exosomes or even past exosomes and get something even better. And PDRN is going to get better, PGF, all of these things are going to get better. Secretomes, all of these things.
PRF is now being utilized more, right? Versus PRP, right?
Yeah. I feel like we're even past that, right? Yeah. It's going to be an exciting time to be in aesthetics.
I think, like you mentioned earlier, I think that, finding ways to increase absorption of product is a way that we're going to be going, right? Like you were mentioning earlier that...
Well, Heidi and I were just at and we were talking about delivery systems, like the needleless delivery systems. And what was your topic? It was like multi, yep. The one and done. Yeah. Who doesn't want the one and done? And we used to think the one and done product was crap and it couldn't do the same thing that all of our individual bottles could do. And now we've got better and better technology that maybe it can.
Yeah. No, I agree. And I think when you look at it, we're not at the point yet where it's like the Jetsons and we put ourselves in a tube and say, I want to look like this. And we're like, oh, and we look like that. But some of the things that people almost would think are science fiction, we can do now.
That's right.
And when you look at the nature, I think, of Moore's law with computers, like basically the rule is always like every 18 months, chips get twice as fast and half the size, right? That also correlates, I think, with technology in our space, right?
100%.
You look at
better fillers, better neuromodulators, better techniques. Better machines.
So was there anything else that you've learned recently internationally, right? That you talked about the technique with the threads and the deep plane facelift. Is there anything else topical or skincare wise that's being done outside the US that is interesting to you that hasn't quite made its way here yet?
Well, I think PDRN's just at its very beginning. It's the calm before the storm, because I think that all these peptide things are really going to explode in our space.
Yeah. So what would you say is your guilty pleasure secret skincare product or treatment that you love, but you rarely recommend it?
rarely recommend.
Yes.
I recommend all.
Is there anything that you have
a secret keeper. I am like, I think that I will stop the lady on the bus and be like, listen, this is what you need. Like, yeah. So I am not a gatekeeper at all.
Yeah, my wife asks me if I ever shut it off because I'll be in the line at the grocery store and I'm like, "Ooh, she has good cherry and jomos. We could get rid of those."
Yeah,
and she's
that's
like, "What are you
exactly
doing?"
We should ask you the skincare.
With skincare, what skincare myth would you like to see banned forever?
What skincare myth do I want to see banned forever? God, there's so much crap out there.
Slugging is a great thing to do. Like, how do you feel about slugging?
No, that's terrible. I'm like, if I get a vascular occlusion, I'm going to take the risks and see how that goes because I do not want something sucking my face
Mm-hmm.
and crawling at the same time. What's a good skincare myth that I don't? Oh, you know how people talk about like the dirty faces? I think people, I've never seen people really over cleanse. I know that there's like this myth of people over cleansing. I've never really seen it. Like, have I seen people dry out their skin and all of this stuff? Yes. But I feel like it's just in one area, like I've never seen anybody really like, and I don't think it's good to have dirty skin ever, and I think it causes milia. It, you know, the dead skin, slothing. I mean, it's not good. It causes acne.
Yeah, well, it's the same thing too. A lot of people think if they have oily skin, they have oily skin, but a lot of times they have oily skin because they have dry skin and their skin's trying to compensate for the fact of being dry.
Yes,
right?
That's exactly.
What would be your best or greatest tip for healthy skin?
I like, actually, what is it? Double cleansing. So I first wipe off all my makeup and all the grime and pollution with a wipe, and then I go in and cleanse because I think that, it's a dirty world out there. So I think double cleansing is everything, and I think you should definitely use a vitamin C in the morning. If you're oily, dry, whatever it is, they have a vitamin C out there for you. That's going to work great. Use sunscreen. Use a retinol at nighttime. And I also like products like that have arginine in it, that like the PTOX, and PCA has one, and what is it? Revox by Revision.
Mm-hmm.
Like all of these, like topical neuromodulator. Do they work? Do they freeze a muscle? No, but they're great for the skin, and they also decrease those dynamic and static wrinkles from forming.
So where we talked about social, for those people that aren't following you, how do they find you online? What are your social media handles? How do they
I only have one. It's so I used to have two accounts. I used to have a personal and a business account, and then I just merged it because it's just too hard. So I'm Barbino Surgical Arts. It's like the worst mnemonic, but it's the only one that people know how to spell my name. So it's like going to the bar twice for a beer, BARBARINO, Surgical Arts. Follow me. I love to interact with the people who follow me. And if you guys have any good suggestions on what we should do on social media, I'd love to hear it.
Yes. Thank you for joining us today.
Thank you, Paul. This was so fun.
So fun. And we have to do it again. And we will have to do one with
Heidi Prather,
who has joined us in the background. If we could get her to come into the camera over here and wave for us.
She's going to do a cameo.
Yeah.
I'm not mic'd, but I've been enjoying all of this. This has been the best day of my life.
She's like the skincare queen. So she's like giving us like snippets in the background. It's so
Make
fun.
sure you say this.
Yes. Don't forget this, Sheila.
Yeah, we just rolled off of our skincare panel. So a lot of passion about skincare in this room.
So I am not a board certified dermatologist, but I am into skincare, and I love all the tidbits that Heidi teaches me, and I love running by all the different retinols and different vitamin C's, and she can give me real feedback on what the derms are saying.
And for people local to where she practices, she's at Westlake Dermatology. Where can people find you online?
So you can find me on Instagram, Heidi Prather MD, and of course, Westlake Dermatology, and this podcast.
Yes, and we'll have to do another podcast now. There's maybe this is a precursor to another podcast, I think maybe.
So I want to point out that like Heidi's literally probably a stone throw away, and I couldn't be closer to her, and I couldn't support her practice more. You know, you don't have to be competitors, and I certainly don't look at her as competition. I want everything good for her, you know, like
And I think that's what's so beautiful too about our fields. I think generally most people are just love what we do so much and want the best for patients.
Yes.
That we can really elevate each other.
Right. And we come together and with great ideas and publications and social media.
Yes.
I'm not as good at dancing, however.
But we'll get her there.
Yeah.
Actually, next time we'll leave with this. The last time Heidi and I filmed for social media, there was a big oopsie daisy.
Mm-hmm.
Oh, so ...
Yeah, ... Paul, just wait.
Yes.
Thank you for joining us.
Thank you. And thank you, Dr. Barberino. Thank you all for tuning in. Dr. Barberino has been a phenomenal guest. I can't thank her enough for being here. The insights that she provided and her perspective on an ever-evolving world of aesthetics are invaluable. The passion she has, always being forward-thinking and staying on the forefront of what the next thing is or what she can do to enhance patient outcomes and safety and consistency is very commendable. One of the things that's constant in this universe is change, right? And it's for treatment, for what patients expect, how patients receive message. It's just always changing, right? And I think one of the most important things to think about when you're thinking about aesthetics in general, or medical aesthetics, is that it's not about changing who you are. It's just feeling your best. And sometimes it takes that procedure to affect something on the outside to make the outside match the inside. And that's just something that Dr. Barberino epitomizes. And clearly through today's conversation, you can see that. Until next time, this is Optimize Outcomes. I'm your host, Paul Fulford. Please make sure to like and subscribe wherever you get your podcasts.